Hi guys, I'm Rohan. Today I will be presenting my public health infographic on influenza in pregnancy, developed for a specific high risk within the community. The main goal of this resource is to increase awareness about the risks of influenza during pregnancy and to promote effective prevention strategies, particularly vaccination. Although influenza is often considered a common seasonal illness, it can lead to serious complications in vulnerable populations. Pregnant women are particularly at risk due to physiological changes that occur during pregnancy, including alterations in immune function, increased oxygen demand, and reduced lung capacity. These changes make pregnant women more susceptible to severe respiratory infections, including influenza. Additionally, influenza infection during pregnancy is associated with adverse fetal outcomes such as preterm birth, low birth weight, and increased risk of hospitalization. For these reasons, pregnant women in New South Wales were selected as a target audience for this research. This aligns with public health priorities that focus on protecting both maternal and infant health through early education and prevention strategies. Supported research process. In the initial stages of this assignment, I used generative AI tools, especially ChatGPT, to support my research process. AI was used to gather general background information about influenza, including how the virus spreads, its symptoms, and common prevention strategies. For example, AI-generated explanations such as influenza being transmitted through respiratory droplets highlighted vaccination as the most effective method of prevention. It also assisted in brainstorming ideas for structuring the infographic and presenting information in a way that would be clear and easy for general audience to understand. However, it is important to note that AI was only used as starting point. It helped guide the directions of my research and design, but it was not relied upon a primary source of evidence. This approach ensured that my work remained academically rigorous and based on credible evidence-based information. Evidence review and fact-checking. To ensure the accuracy and reliability of the information, I conducted a thorough literature review using reputable and authoritative sources. These included global and national health organizations such as World Health Organization, the Centers of Disease Control and Prevention, the Australian Institute of Health and Welfare, and NSW Health. Peer-reviewed journal articles were also used to support clinical information, particularly regarding the risks of influenza during pregnancy and the effectiveness of vaccination. I compared the information related by AI with these sources to identify any inconsistencies or gaps. For example, with AI correctly identified vaccination as important. It did not always emphasize that influenza vaccination is safe in all stages of pregnancy. This information was confirmed through evidence-based guidelines and was included in the final infographic. Any outdated or unsupported information was excluded. This process ensured that the final resource is accurate, current, and aligned with the best practice guidelines in the public health and nursing. This process ensured that the final resource is accurate, current, and aligned with best practice guidelines in the public health and nursing. Design and development. This infographic was created using Canva, which is a digital design tool that allows for the development of visually engaging and accessible educational resources. The design was guided by principles of health literacy, ensuring that the information is easy to read and understand for both broad audience. Simple language was used throughout the infographic to avoid medical jargon, making it more accessible to individuals without a healthcare background. The layout was structured logically, starting with a brief explanation of influenza, followed by symptoms, prevention strategies, treatment options, and potential complications. Visual implements such as icons and colors contrast were used to enhance engagement and improve Large fonts and clear headings were included to ensure readability, particularly for individuals who may have varying levels of health literacy. Special emphasis was placed on key messages such as the importance of vaccination and early medical care to ensure that the most critical information is easily identifiable. Overall, the design aims to effectively communicate important health information in a clear, concise, and visually appealing way. So the last slide is critical reflection. This assignment provided valuable insight into the role of generative AI in nursing and healthcare education. One of the key lessons learned is that while AI can be a useful tool for brainstorming and organizing ideas, it has significant limitations. AI-generated context may lack specificity and may not reflect the most current guidelines and often does not provide references, making it unreliable as a sole source of information. Therefore, it is essential to critically evaluate all AI-generated context and verify it using credible evidence-based sources. As a future nurse, ensuring the accuracy of information and maintaining patient safety is a fundamental responsibility. A major strength of my resource is that it is evidence-based, clearly structured, and specifically tailored to a high-risk population. The use of simple language and visual design enhances its effectiveness as a health promotion tool. However, a limitation is that the infographic may not fully address cultural diversity or language barriers within the community. A major strength of my resource is that it is evidence-based, clearly structured, and specifically tailored to a high-risk population. Future improvements could include translating the resource into multiple languages or adapting it to better suit culturally diverse populations. Overall, this assignment highlights the importance of combining technology with critical thinking and evidence-based practice in nursing. So, while concluding it, in conclusion, this project demonstrates how generative AI can support learning when used responsibly alongside critical appraisal and evidence-based research. The final infographic aims to provide clear, accessible, and important health information to protect both mothers and babies from influenza. Thanks for